First at 4, the CDC has new recommendations for people who decided to travel during Christmas holiday. Eyewitness News reporter Jordan Foster talks to one local health official about what people returning home should consider once they make it back.
Over the Christmas holiday, TSA screened nearly 1.3 million people who traveled. As travelers return home, health officials are asking everyone to be responsible and know their status.
We're still very concerned. Hospitalizations for COVID continue to escalate.
We talked to UT Health San Antonio's Chief Medical Officer, Dr. Robert Leverance, before the holiday break, who was concerned with high hospital numbers in the San Antonio area.
We're still worried that by early January, particularly after New Year's, when people gather once again, that we'll see even another surge, another blip. And at that point, we might have to consider a field hospital.
He says to help avoid this, the CDC recommends people who traveled to be proactive and get tested 3 to 5 days after returning. Right now, hospitalizations for COVID patients in Bexar County hospitals have been more than 15% of total patients for more than 7 days now.
Traveling is not an all or none thing, meaning that if you make the decision to travel, it's not like, well, okay, I guess, it's just an unsafe situation. No, we can still travel and do it safely, including when we return back home.
And he says those people waiting on results to get back should limit their movements to essential activities only, even if they are not showing symptoms.
This virus completely depends on our behaviors. This surge is not completely left to fate. It does matter how we behave.
Jordan Foster, KENS 5, Eyewitness News.